When you're learning something new, it's sometimes tricky to know whether you really understand the material. And one of the best ways to do that is by taking a test that includes well written questions that assess whether you really do understand the material. In fact, great questions, ones that are really well written, make a big difference in assessing not only the facts that you know, but how you apply those facts to solidify and retain that knowledge. So, how are these great questions written? Well, when it comes to multiple choice questions, there are some ways to avoid making the answer obvious to a person who's test wise. In other words, someone who can pick up on subtle unintended clues and narrow down the choices or zero in on the answer without actually knowing much about the question topic. The first trick is to create good distractors that can't be easily eliminated. First, make sure that all the options follow grammatically from the stem. For example, from this set of options, only B, C, and E follow grammatically from the lead in. For test-wise students, and by students I mean learners of any level that are answering the question, this sticks out like a weed on the lawn. A and D would be eliminated right away because the vowel at the beginning of these options calls for an an at the end of the lead in. This is a classic error because question writers generally make sure that the correct answer is grammatically consistent, but might be less careful with the distractors. One easy way to avoid this mistake entirely is to have the lead in be a complete sentence that ends with a question mark. Alright, and secondly, when the response options are part of a logical set, don't include options that aren't. For example, look at these options. 3 of them cover all the possible options for morphine: less morphine, more morphine, or the same amount of morphine. And then the last option seems like an afterthought that has no actual relationship to the others. That said, students would eliminate D right away. If a set of options is mutually exclusive and exhaustive, then one of them has to be correct, and there's no point in including other options. And third, you want to avoid absolute terms like always or never, because that's a red flag since extreme statements are unlikely to be true. Here's an example where both option A and B violate this rule. It's also a good idea, though, to avoid wishy-washy words, like often, typically, and sometimes, since they're more likely to be correct. Now let's focus on tips for creating a good correct answer. That is, one that'll blend in with the distractors. First, you want to make sure that the correct answer avoids convergence, which is where the correct answer has the most elements in common with other options. Take a look at this example. Oftentimes, a question writer prepares a question stem and a correct answer, and distractors are generated by writing variations on the correct answer. Students can easily work backwards by looking for word repeats and picking the option that has the largest number of elements in common with the other options. In this case, option A has the most repeats, with tobramycin coming up 3 times and ticarcillin coming up twice. Second, you want to make sure that the correct answer has similar length and complexity as the distractors. Looking at this example, we see that option D is a lot longer and full of nuance compared to the distractors. Students would probably choose it just because it looks like a lot more thought went into writing that option versus the others. And they'd probably be correct in making that assumption, since item writers often take more time writing the correct answer, adding extra details to make sure that it's clearly the most correct option, and doing a little teaching along the way to make it a good learning experience. Similarly, if only one option is a double option, then it's also likely to be correct. Okay, so those tips will help with any multiple choice question. But in the health sciences, there are some specific ways to make questions really awesome. First, and most important of all, the question should be about the application of knowledge, rather than the memorization of isolated facts. Questions should focus on common and challenging issues in topics that affect patient care, with a particular emphasis on common mistakes and misunderstandings. To do this well, it's best to avoid cliche buzzwords like blue sclera and cogwheel rigidity, and instead use less interpreted clinical descriptions of findings. This side-by-side example shows what these differences look like, with the recall version using the term acute ischemic stroke, whereas the application version uses the clinical description sudden onset of weakness of the left arm and leg and drooping of the mouth. The options are the same, but the application version is more challenging because it requires interpreting information, rather than simply giving away the diagnosis. Next, try to write the question stem in the form of a story or a vignette. It could be about a patient, a clinical practice issue, or even a research study. Since the patient vignette's the most common, let's run through that one in a little more detail. For starters, it's good to make sure that each relevant part of the patient vignette is included in the following order: patient age and gender, site of care, chief complaint and duration of symptoms, pertinent history like an HPI, personal and family history, and medications, as well as physical exam findings, and in some cases, results of diagnostic studies in response to initial treatment. It's also always a good idea to use real clinical photos, ECGs, and imaging studies, because that makes the questions more realistic and challenges students to interpret information. After the question's framed up, there's a lead-in, which is the final part of the question stem that leads into the options. A good lead-in clearly defines the relationship between the stem and the option set. In fact, it should be possible to answer a question with the options covered up, or at least come pretty close. When that's not the case, it generally means that the lead-in's too vague. For example, a lead-in like, "which of the following statements is true?" couldn't possibly be answered if the options are covered. For the same reason, it's best to avoid negating words, like least, except, or not, because there might be multiple correct answers, which means that there's not enough specificity. Now, moving on to the options, it's important to make them as homogeneous as possible, so they can be order ranked along a single dimension. For example, the likelihood of a diagnosis, going from the most likely to the least likely. This also allows you to assess clinical judgment, challenging students to make more subtle distinctions among the options. In contrast, there could be a correct answer with 3 random options as distractors that don't have any relationship with each other or with the question stem. A question like that makes it easy to answer, tends to test knowledge of isolated facts, and offers less learning value. As a final point, once the question and the options are written out, it's good to take a step back and make sure that it has a long stem and short options, and doesn't have any redundant text. That way, the students are spending most of their time reading and understanding the clinical situation, and then answering a relatively focused question about it. Okay, as a quick recap, writing good questions in general can be done by making sure that you have a good story or a vignette, and that the option set is well written, so that the correct answer blends in with the distractors. For health science questions in particular, it's important to make sure that the question tests a specific clinical application of knowledge, with options that can be rank ordered along a single dimension, rather than testing recall of isolated facts. Thanks for watching. You can help support us by donating on Patreon, or subscribing to our channel, or telling your friends about us on social media.